Well, today I'm joined by MPP Natalia Kusendova. Thank you so much for joining us today. Let's start with, tell us a little bit about yourself. Now, you, before politics, you were a nurse. You've decided to go back to the front lines. When did you do that, and why did you decide to do that?
Well, first of all, thank you so much for having me, Phil. It's a great honor to join you this morning. So I always wanted to maintain my nursing license, and so I always maintained a casual status at William Osler Health System. So I would pick up shifts here and there, but very sporadically, because as you can imagine, my MPP schedule kept me very busy. But ever since COVID hit and we had a call to action for retired nurses and non-practicing nurses to return to the front lines, I decided my skills are best utilized in the front lines in the emergency room, and I rejoined my colleagues. And it's been so far a very great experience.
So you're at Etobicoke General. I understand that Etobicoke has a COVID-19 unit. Can you tell us a little bit about the unit?
That's correct. So the COVID-19 unit is fairly recent, and it is meant for patients to be transferred directly from our long-term care homes, which are in the area. As you know, some of our long-term care homes are having some challenges in terms of staffing. And so we're trying to offload the pressures. So these patients are transferred directly from long-term care, and they bypass our emergency room, and then they're assessed here by our hospitalists. But it is emergency room nurses which are taking care of these patients. I had my first shift in the COVID zone on Sunday, and I have to tell you, it was quite a challenge, both physically and mentally, because we have to make sure that we properly don and doff the personal protective equipment, such as masks, eye protection, gloves, level 2 surgical gowns, and we have to follow that procedure every single time we go into a patient's room. So it is a mental exercise. We also have to cluster care, meaning that we have to think of all the things that we have to do for one patient, whether it's feeding or changing or giving medications or taking vitals. We try to minimize the amount of times that we are actually entering a patient's room, so that we minimize the contact with patients and also exposure to our colleagues. And on top of it, it gets very warm and sweaty and itchy underneath all the PPE. So it's both a physical and mental challenge when you have a 12-hour shift and all of your patients are COVID positive.
Now, tell me a little bit about what is it like for someone who has COVID-19? What's it like for a patient in the hospital who has it?
Yeah, so there are two scenarios. So for people who are coming in with mild to moderate symptoms of COVID, we swab them and then we send them home with a COVID package, and we instruct them to self-isolate, and then they basically await their results at home. But for the patients that do need to be hospitalized, it depends on the severity. But if they have what's called full code status, meaning that we will be doing CPR or intubation, that's one scenario. But in the COVID zone, most of our patients are DNR status, so do not resuscitate. Again, these are mostly long-term care patients, so they are coming in to offload some of those long-term care facilities. And so most of them are end of life or palliative care patients. And so we're really providing more comfort measures, such as pain medication and oxygen, et cetera. And, it is quite difficult because these are some of these patients, it's their last few days of life. And as you know, we have a strict no visitor policy. And so it can be a very, very difficult experience, not only for the patient, but also for the families and also for the caregivers and the nurses that are taking care of these patients. And so we try to, as much as possible, connect them via teleconference or via video conference with their families, but it may not always be possible.
Now, you had your first experience with someone who didn't survive COVID-19. Can you tell me about that?
Yeah, so that was a very difficult experience for me, I have to say. It was a COVID-19 patient, positive. He was an 82-year-old gentleman, and we knew he was going to pass away, and he was DNR status. So at this point, we wouldn't even call the doctor. It's basically the nurses are taking care of the patient and providing comfort measures. And so we don't really know when the patient will pass away, but we can sort of gauge whether it will be on this shift or the next shift. And so we just wanted to make sure that he is not alone when at time of death. And so trying to go into that room and we're looking at the trend of vitals, blood pressure is dropping, oxygen saturation is dropping. So I was very nervous all day because I really didn't want that patient to pass away by himself. And so I also called his wife and she said, to play his favorite song that he recorded. He was actually a guitar player. So during, when he's passing away, she really wanted me to play his favorite song for him. And so I was, on standby all day for 12 hours, just trying to make sure that I get into that room on time. And luckily I did. And I was holding his hand when he took his last breath. And I was looking into his eyes, and you can see the moment. You can really see the moment once that life leaves, because the eyes become a little bit shadowy and dark. And so, I feel fortunate and privileged to be able to be there for that patient at that time. But I cannot imagine what it is like for the family all day on standby, just waiting to hear that news. And so it is a difficult time for everyone involved.
Now, the province today reported the smallest case increase in 6 weeks, and the province is also starting to loosen the COVID-19 restrictions. You, as a health professional, do you think it's too soon?
Well, you know what? I think it's all about balance between the health and safety of Ontarians and also our economy. Interestingly enough, I do have a lot of patients coming in with mental health issues. Even today, I had a lady coming in with anxiety and panic attacks because she says all of her businesses had to close and she's having financial issues. So, the impact of COVID is multifold. It's on mental health, it's on the economy, it touches all of us. And so I think it's important to follow the advice from our chief medical officer, Dr. Williams. And so all the decisions that we are taking, we are consulting with him. We're also consulting with the federal government. And so, it's hard to say, but I think it is time to slowly start loosening the restrictions. But we have to still maintain social isolation protocols, proper hand washing techniques. When we're going outside wearing non-medical masks, all of these things will help us to continue to flatten the curve.
All right. Now, there's still new cases every day. What do you say to those people who aren't taking it seriously? They're saying, you know what, it's been weeks, I'm good. What's your message?
You know what? My message is that if it was your loved one being in the hospital, diagnosed with COVID-19, and perhaps end of life, then perhaps they would have a different attitude. So just to be very mindful of that. They're very lucky if they haven't been impacted directly by COVID-19, but so many Ontarians and so many Canadians have. And so we really need to continue taking this seriously and, staying at home as much as possible, going outside only for essential errands. And that hand hygiene, I cannot stress the importance of hand hygiene, at least for 30 seconds, either with water and soap or with a 70% or more alcohol-based sanitizer.
All right. Now I want to ask you about how do you prepare yourself to go into the ward, like a COVID-19 ward? How do you prepare yourself to go into a 12-hour shift? How do you do it? How do you stay strong?
You know what? I think it's what we do in between. That's very important for me. For my mental wellness, what I do a Zoom workout with my girlfriends through Zoom. We do like a 30-minute ab video or arms video, whatever it may be. That's what helps me, but also trying to stay connected. I call my grandma who's in Poland. I call her on a regular basis. Of course, they are also impacted by COVID-19 in Europe. And so just sort of trying to keep track of what's happening there as well. But I think it's so important to remain connected with our friends and even reconnect with some of our previous acquaintances. I think at this time, we're all in it together, and making sure that our mental health is taken care of is really, really important.
And this is Nursing Week. What's your message to our nurses?
Well, so, the World Health Organization declared 2020 the year of the nurse and the year of the midwife. And I think it's sort of like almost like a joke, but not really, because it truly is the year of the nurse. We are called to this immense challenge that COVID-19 presents. And so, I just want to say a big, big thank you for all my nursing colleagues for stepping up to the plate and for exhibiting courage and determination and going into work each and every day and continuing to be compassionate and to listen to our patients and take care of our families. For me, the transition back into nursing life has been almost seamless. My colleagues welcomed me. They explained all the protocols. They walked me through the different drills. I did a Code Blue simulation. It's called Protected Code Blue, which is for a COVID-19 presumptive case. So for me, it's just been very rewarding and inspiring to see how we come together as nurses and healthcare providers at a time of crisis.
All right, I've been speaking to MPP Natalia Kusendova, and she's also a registered nurse. We want to thank you for going back to the front lines in this fight against COVID-19. Thank you so much.
My pleasure. Thank you.